the Toronto Star. I'm Saba Itazaz, and this matters. It's been almost 2 years of this pandemic and a mandatory mask policy. Some of us have become as good at smizing as Tyra Banks, and for others, the masks are slipping a little bit. Health experts say that is not a good idea. I've talked so much about masks on this podcast. Cloth masks, surgical masks, the when and why of wearing them, and what the mask symbolizes culturally and politically in this massive shift that the pandemic has brought to our lives in our times. The one thing that has remained constant is that we will be living with the reality of the mask for quite some time yet. With winter months bringing in an uptick in COVID cases and things reopening and a relatively static vaccination rate, Canada's top health officers are urging people to double down on masking. Masks are the last line of defense against this virus. Meanwhile, there's been a major shift again in the conversation and culture around the mask, and the new data keeps coming in. So we thought we'll do a little bit of a refresher on masks. How do we wear them, which ones we wear, and why we're still talking about it. Star reporters May Warren and Kenyon Wallace recently did an in-depth explainer on this, and May Warren is joining me now to help explain some of it. Hello, May. Nice to have you on the podcast.
Thank you for having me.
Has the culture and practice on masks shifted again? There's been a sense of slipping up, especially after things are reopening and the vaccines, and I'm not seeing as many masks on people. Have you observed that?
Yeah, I think that's true anecdotally, at least. I mean, here in Ontario, we still have the mask mandates. You have to wear them when you're inside public places. But of course, if you're going to a restaurant or bar, you can take them off to eat and drink. But you can see when you go into those places that as soon as someone sits down at a table, they take it off and it doesn't really come back on again. Seeing a lot of people in the subway or, inside stores with the mask kind of under their nose or, we've all seen that kind of thing. I think there is a sense of just a little bit of, being a bit lax with the masks now that so many of us are vaccinated.
Yeah, and it's also almost been 18 months into this pandemic as well. Let's refresh it a little bit for people. What's the latest advice on this from Health Canada and public health officers? I believe there was a series of tweets as well recently.
Yeah, so Dr. Theresa Tam tweeted, I think it was a week and a bit ago, just about the importance of masks. And, for sure, the vaccines are great and they work. We're really lucky that we have access to them here in Canada. But you were just kind of tweeting that, the masks also provide us with a good layer of protection and they're an essential top layer to prevent or reduce the virus inhalation and spread between people. And then she also talked about ensuring that your mask is of the best construction and fit possible is really important to kind of seal out and filter out infectious particles that are suspended in the air we breathe. And, as part of that, she's also kind of acknowledging that COVID can spread through the air. And she even used the metaphor kind of like secondhand smoke, when you're particularly when you're in a crowded small space, those secondhand smoke fumes will kind of come all at you and you'll breathe in a lot of them. It's kind of the same with COVID and it is airborne and particularly in small crowded places. If you have a good footing mask, it can protect you from the virus as well as the vaccine and other things like, having good ventilation in a space and opening windows and things like that.
And I will get into the different kinds of masks as well as the latest science on this, but there might be people who are fully vaccinated and they might not really see the point or urgency of wearing a mask. What are healthcare workers saying to those people?
Yeah. And definitely don't want anyone to think that the vaccines don't work or the vaccines aren't really important because they're great. But just having a mask, as Dr. Theresa Tam said, can just provide like another layer of protection. And although we're lucky to be at a high rate of vaccination here in Ontario, I think it's about 85% or so for 2 doses of the vaccine, that still leaves a lot of people who are not vaccinated. And as we know, kids 5 to 11, the vaccine was just approved for them. So that's happening now. So, you could still come into contact with people that aren't vaccinated. So it's just kind of really giving yourself that extra layer of protection, especially with the Delta variant, especially with more people heading inside, with the weather cooling off and with cases ticking up again.
Right. But May, is Ontario's mandatory mask policy still in effect? Have there been any changes to it that we should know about? And if it's all still the same, how has enforcement looked like on this?
Yeah, so it's still in effect and, most people are still wearing them, but you do see it slipping a bit, whether it's people, not wearing the mask correctly or, maybe, for example, taking it off at a restaurant. You're allowed to take it off when you're eating, but you see a lot of people, they just tend to take it off as soon as they sit down at the table. So just be aware that that kind of leaves you unprotected for the whole time that you're eating. And we know that COVID can travel through the air, it's spread through the air. So you're kind of sharing air with everyone around you if you don't have the mask. And we do have the vaccine certificate policies in place for places like restaurants and bars, which is great. But it's always possible that someone has kind of snuck through. So I think the message is just kind of be aware of when you don't have the mask on and make sure that you're wearing a well-fitting, well-constructed mask.
And every time we talk about it from the enforcement aspect, it's a little bit tricky, right? How do experts see enforcement versus recommendation, like that dynamic play out, considering how mandatory mask policies have led to, we've seen more political polarization, there's an anti-mask movement, and we've all seen those viral videos of confrontations where people just refused to wear them and asked to do so. So how do you see that dynamic now as the conversation is reignited on masks?
Yeah, I think most people are still wearing them and the majority of people are, continuing to comply with that. But I think it can be hard if there's someone who's just not wearing it correctly or something like that. It can be hard for frontline workers to police that. They have a lot of other stuff going on and they're often becoming the bad guy, asking someone to put on the mask or to wear the mask. Sometimes they're not trained for that. And I think that can be tough. So if you can make sure that you have a good mask, that kind of gets around you being exposed to people who maybe aren't following the rules as closely.
Mm-hmm. And how have other regions been navigating the mask policy? I know there's been some reversal as well, right? On the mask policy being suspended and then it's come back.
Yeah. For example, Alberta this summer, they got rid of the mask mandates, but then they ended up bringing it back in recently due to a spike in cases. And I think Yukon was an example as well of a place that brought the masking in indoor public spaces in after a spike. So in Ontario, we've had the mask mandate the whole way through. And so far, we haven't seen like a huge spike in cases. So some experts are saying that's one of the reasons why we fare a little bit better than some other provinces and some other places.
And I found it really interesting that you also wrote about how the conversation is shifting in the sense that previously there was this emphasis on, help protect others around you, be responsible towards people around you. But this has become different now. It's also about yourself, about protecting yourself too, right?
Yeah. And, the way that we understand the virus has shifted over the pandemic. It was a new virus. We didn't really know how it spread. And now that we understand the airborne spread, it really highlights the importance of the mask, not just for other people, but for yourself. And actually, Health Canada very recently kind of quietly updated their guidance on masking on their website. Whereas before, the messaging was kind of still from, the beginning of the pandemic, and it was talking about how to make a non-medical mask yourself and that kind of thing. Now they've really kind of stepped up the guidance on masks and they're actually recommending that if you're high risk, you should be getting a medical mask or even a respirator if you can find one. They're telling you what masks you shouldn't be using. Like some of us have seen the scarves or bandanas or the neck gaiters or the clear face shields. Those are no. And just, emphasizing the importance of a good mask, basically.
So you said they were updated on the website. Have there been any public announcements around this?
Theresa Tam did tweet about the importance of the masking around that same time. And yeah, I think she was kind of trying to call attention to this shift in understanding about the airborne spread and also the mask. But definitely she has been criticized for taking, a while to so publicly acknowledge that, like on her official Twitter account. And there have been some experts that have been calling out the government about what was outdated guidance on their website that's now been updated.
We'll be right back. Any recent examples of what can happen or has happened when masking protocols have broken down?
Yeah, there was a recent example. I think it was a church in Barrie, and one of our sister papers, I think it was the Barrie Advance, was reporting about that church and that there had been some complaints around masking, I think, in the past. And it's tough with COVID to ever say like this one thing caused that. But yeah, that was an example of, masking possibly coming into play. And yeah, definitely Alberta and Saskatchewan got rid of their mask mandates and then reinstated them after a surge in cases.
Obviously, it's hard to establish that correlation, but there was an outbreak in that area, right? In Barrie. I think you wrote about that too.
Yes, there was an outbreak at a Barrie area church, and the Barrie Advance, one of the Star's sister papers, has written about it a lot, done some great reporting there, and they've reported that there have been complaints over both masking and physical distancing at that church, which was linked to at least 24 COVID cases.
Can you talk to us about some of the international case studies and some of the latest research? Because you mentioned that in your reporting that shows some connection between mask wearing and low COVID fatalities.
Yeah, so there was a study published in the December 2020 edition of the American Journal of Tropical Medicine and Hygiene, and it found that in countries where masks were the norm or supported by government policies, per capita weekly COVID deaths increased on average by 16.2% compared to 61.9% in the countries that didn't have such measures. And there was also a really big randomized trial involving rural Bangladeshi villages. And the researchers actually distributed masks to the villagers and, promoted them amongst them. And they found a 9% decrease in symptomatic COVID cases in villages where cloth masks were distributed and promoted, and an 11% decrease in villages that had the surgical masks. So that's a preprint study, but it's been submitted to the journal Science. And then we also talked to some researchers who actually looked at, different types of masks and how they performed at blocking respiratory droplets. And they found that the N95 mask was kind of the gold standard, but surgical masks were next. And they specifically pointed out that neck gaiters, bandanas, and any kind of knit mask actually did not do a good job. So definitely stay away from those ones.
So are cloth masks out as well?
I think it depends who you talk to. Some people are saying that they're not good enough, but Health Canada only says that you need the surgical mask or the respirator if you're high risk. I think it really depends also your personal risk profile probably as well. I know not everyone can get an N95. That's tough to find, sometimes inexpensive. They can also be kind of uncomfortable, but you can find a KN95 at Shoppers. And so that's available. It's a little bit more expensive than just a surgical mask. But the surgical masks at the beginning of the pandemic were, hard to find. They're now widely available and pretty cheap. So that's one as well that, we don't have the same problem of access anymore so much. So I think a lot of experts would kind of recommend the surgical mask, KN95, N95. But if you only have a cloth mask, I think make sure that it's well fitting and that it has a few layers and, because some are much better than others.
It's better to wear the one you have access to rather than the alternative of not wearing one at all, right?
Yeah, the experts seem to agree, definitely wearing a mask, even a cloth mask was better than no mask, but definitely some masks are better than others. And there's a lot of consensus on the better masks if you want to go for that. And some experts say that, everyone should be stepping up their game.
Yeah, that makes sense. So where should Canadians go to sort of get the latest guidelines and updates around masks and their usage? You said the Health Canada website, that's the best place they should be heading into now because there's been some new stuff there now.
Yeah, so the Health Canada website has a whole new section on COVID-19 mask use. And it kind of takes you through this whole thing about what type of mask to choose and what we know so far and how the knowledge has changed. And I know it can be confusing because we've gone from at the beginning of the pandemic, them saying you don't need a mask to maybe you do, you definitely do. Now you need a better mask. But, it is evolving our understanding of this virus. That's how science works. And yeah, the Health Canada website has some good resources now about masks and tries to answer some of these questions.
And May, other than the government directives, we've had this conversation about perhaps the need to see a massive cultural and behavioral shift around masks. And we've talked about this before, but do you think we've established one somewhat in the 2 years of this pandemic? People are getting used to it?
I think so. I think most people have very quickly adapted to it. And I think most people realize it's not too much of a burden to wear a mask for a couple hours each day when you're shopping or on your subway or maybe even several hours a day at work. And it is a very low cost, low barrier thing. And I think that's kind of why you're seeing the masking mandate in Ontario continue and other places bring them back. And it might be kind of a legacy of the pandemic that they stick around for a bit on public transport or whatever, even if these mask mandates eventually do get scaled back, hopefully as we kind of make our way out of this pandemic.
And also, how important is it to remember that masks are important, but masks alone can't keep us safe?
Yeah, I think that's something that all the experts stress is that it's not just like, okay, you have this one thing and you're protected. Obviously, the vaccines are amazing. You need to get vaccinated. That's very important. Masks can help on top of that, as can things like just improving the ventilation in your room, opening windows, having HEPA filters, staying away from like spaces that are very crowded and like small with low ceilings and things like that. And if you think of that secondhand smoke analogy, just think of like, where would these droplets be going? Like, are they going to kind of dissipate in the air, or are they all kind of in one area and am I kind of breathing them all in? So yeah, definitely it's not just like masks and we're done. It's really many different things that we need, many different strategies. Not one alone is going to get us out of this, but this is one that, can continue to protect us.
Which leads me to my final kind of existential question, which is, are we ever going to take off masks? Because I know there's a debate currently in the US as they're getting back to normal and they're talking about whether there needs to be an exit strategy or does this need to continue. But at the same time, we've seen so many regions and countries first lifting and then having to reverse their mask policies, right? Depending on what's going on with COVID-19. So are we ever going to be in a world without masks?
I think the provincial government has said they're looking at hopefully lifting the mask mandate sometime in the spring, if things continue to go well. So I could definitely see that maybe the requirement to wear one inside stores, maybe that lifts. I don't know. It's really hard to predict, but eventually. But yeah, maybe we will keep wearing them, on public transit, or maybe, when you do have a little cold, you might keep wearing one just to protect people around you. Maybe when you're flying. Like, I think that the legacy of this will stick around with us for a while, even if it's not necessarily a legal requirement. It's really becoming like a cultural norm and you can see the shifts. And I think a lot of people are, really fine with it and just want to kind of get back to life as normal as possible. And if wearing a mask is part of that, then to me, it doesn't seem like a huge sacrifice, to be honest.
Yeah, looking at the bigger picture for sure.
Yeah.
Well, thank you so much for your time and your insight. It was great to talk to you, May.
Thank you so much. Great to talk to you as well.
I was talking to Star reporter May Warren. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Muther, and Sean Pattenden. Our music is by So-Called, Mike DeAngelis, and Sean Pattenden. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.